Oh, did you see how far back that knee went? Oh my gosh. Messi, Ronaldo, Neymar, some of the greatest soccer players in history, but even these legends aren't injury proof. In honor of the World Cup, today we are reacting to some of the most brutal injuries in soccer or football if you're watching outside the US. Let's dive right in.
37e minute du match Blackburn-Liverpool, Cissé déborde de côté droit et puis s'effondre. Un choc apparemment
it's done. Oh, that is painful. Mid shaft, that's a tib-fib fracture. You have your tibia and your fibula from your knee down to your ankle. When I say tib-fib fracture, both those bones are broken.
en apparence seulement. L'image est terrible.
Oh, you see it. Wow. The concern is this an open tib-fib fracture, meaning did the bones pop out of the skin? Are they stuck out of the skin? Or did they go out and then come back in? Your first treatment is going to be alignment and just keeping it straight. Your second treatment is going to be trying to put it in appropriate alignment or reducing it. You can have decreased perfusion or decreased blood flow. Oh, did you see how far back that knee went? Oh my gosh. Blocked out, hyperextended knee is going to cause injuries to the supporting structures of the knee. You can rupture an ACL, a PCL, and then you can have some disruption of the other connective tissue. In his case, he ended up rupturing the ACL. Oh, that's gotta hurt. That's gotta hurt. When somebody ruptures an ACL, you usually hear it. Sometimes onlookers can hear it, but a lot of times you hear it inside you when it actually ruptures.
You can feel it.
It's going to swell a ton, you're going to have a ton of fluid, and extreme amount of pain. Oy. We'll get an x-ray to make sure that there's no bone that got avulsed off with the ligament. Usually we give you pain medicine and put you in an immobilizer and get you seen by the orthopedic surgeon, typically in their office. They want swelling to come down before they end up going in there and repairing. Oh, Raúl Jiménez is in the yellow jersey. He ended up getting a depressed skull fracture on the right side of his head. On the side, the parietal bone. You can actually injure the middle meningeal artery, which can lead to an epidural hematoma, which, if not addressed appropriately, could actually lead to brain herniation and death. Thank goodness it did not happen to him. He ended up having surgery. He's back to playing, but actually when he plays, he wears a specific headgear that protects that area.
It's a cut, Hugo. Yes, it looks like a cut. Right?
Oh yeah, he cut his thumb. Ow. Lacerated thumb and almost appears to be a partial amputation on the distal end of his thumb. We see these quite often here in the emergency department. You can see different tissue that you normally wouldn't see deep inside, subcutaneous tissue, muscle tissue. What you're going to end up doing in this setting is rapid put pressure on it, get the bleeding to slow down. We will attempt to fix this in the emergency department unless it is so bad that they need a specialist. Oh, I know this one.
I've seen this one.
Oh, I know this one. I feel so bad. So this is Musiala, one of my favorite players for Bayern Munich and the German national team. So this happened last year. He ended up having a fibular fracture with an ankle dislocation. He got really lucky in a weird way that he doesn't have a tibia fracture as well. For most people, if it's non-displaced, will heal on its own. But if it's displaced or professional athlete, probably going to get some hardware put in there for stabilization and allow the bone to heal around that. And then the dislocation needs to be put in sooner than later, but they won't do that typically unless they have an image. Oh, but you can see it's still dislocated, the angle at which it's sitting out. So it's actually dislocated laterally. Stabilization, get the person to the closest hospital. Conscious sedation, we use a couple different medications. Ketofol is usually the most common one that I will use. So it's ketamine and propofol with some anti-nausea medicine. You can do half doses. One is a sedative, the other one is a dissociative hypnotic. Oh, don't look at it, bro. Oh, it's nice. Harry Kane trying to console him. If it's an isolated dislocation, the connective tissue around that joint now has been stretched out. So you have an increased risk of it dislocating again. So you really need to work to strengthen everything up in that area and to retighten it. A lot of times when it comes to like ankles like this, you can use a small brace for support. Oh, Barcelona, Messi. Oh. Instant. Look, he's grabbing exactly where his injury is, right at the elbow. Falling out on an outstretched arm. We call this a FOOSH, fall on an outstretched hand. Depending on the individual, is it a wrist fracture or a mid-forearm fracture or an elbow fracture? A lot of times we'll also see a posterior elbow dislocation with this.
I don't often see Messi rolling about in agony like he is here. This has really hurt him.
Messi ended up getting a proximal radial head fracture. Your radial head is actually almost a round bone that sticks in an annular ligament up top here and allows for this simple movement. When you actually fracture that, that's going to impair this movement. You'll need a specialist to be able to figure out how to repair this bone because of the tricky nature of the joint itself.
Very, very sneaky, sir.
Oof. Oh, you can see how it bends. The bones can bend a little bit, but not to that extent.
Too much. Let's see from this angle.
Here's a true injury. It hurts. He's on the ground, not moving in pain, versus the ones that roll around a lot.
It's the fall, isn't it? Yeah. I have to say, immediately looking at the
More common injuries that we end up seeing are more the olecranon fracture, which is actually your ulna, and we'll see more distal radial fractures. Radius is a bigger bone at the wrist than it is at the elbow, and opposite relating to the ulna, which is quite interesting how we are made.
More game to be played.
Oh, Neymar, poor guy. Look at that ankle just gone. Oh, it's awful.
That's awful.
Ankles are not supposed to invert like that. Those connective tissues on the lateral aspect of the ankle can give way. So when we say that there's a sprain to the ankle, we're talking about the ligaments on that side. And there are 3 major ligaments over there. 2 of them are the ones that actually take most of the damage. The most common that you get injured, anterior talofibular ligament, and then the other one would be your calcaneofibular ligament.
Signaling to the bench right away that it is something serious.
Yep. Oh, with ligaments, they take a very long time to heal. It can be really frustrating, painful. You can actually have chronic pain. There's a lot of rehab that has to go on. You're going to be taping your ankle very often when you're playing. You really don't want to be taping your ankle all the time when you're not playing, because then you're losing your ability to strengthen that area because now you're using a crutch so often. Oh. Got a cleat to the face. Ended up getting a laceration around his eye. So thank goodness his eye was not injured. Simple lacerations to the face are very easily managed. It's just interesting what they can and cannot manage in professional sports. But he did score. Yeah, nice.
But can you blame the blue and white defender for trying to get this out?
No, of course not. It happens.
It happens.
Somebody comes in with 1 or 2 centimeter laceration to the face. It's going to bleed a lot, but direct pressure to the area pretty hard. You're going to push on it. What we end up doing in the hospital is anesthetizing the area, clean out the wound, suture closed, staple it closed, use glue, steri strips, whatever is available.
Cristiano Ronaldo, he sees it there to be one.
Oh.
It's not that.
Luckily, he just had the laceration, but getting kicked in the head, you're also worried about eye socket injury, intracranial bleeding, ocular trauma. You're going to assess the eye, make sure vision is good. You're going to check ocular motion. So you're going to check all fields, movements of the eye, and make sure it's moving appropriately. Oh, a vasovagal syncopal event is a fancy medical way of saying that they passed out. The vagal tone, having to do with your vagus nerve, has to do with impulse into the heart. And so sometimes being bent over like that, different blood pressure responses, it can mess with blood vessels and tone. Out cold, passed out. You see that there's like a little rhythmic component of the lower extremity. People will tell me that they had a seizure, but a lot of times the brain is deprived of a little bit of oxygen. This is more of a hypoxic type, jerking type motion versus a true tonic-clonic seizure activity. They're assessing, checking him, see if he's awake. Usually it will take a couple minutes to wake up. And then they roll him to the side, which is appropriate for any scenario as long as he has a pulse. You want to make sure that they're not including their own airway with their tongue, as well as any regurgitation, even drool as well. Oh, head collisions. Those are the worst. Staying calm under pressure is no easy task. And that's exactly one of the reasons I created Chillax by my company, Life Happens, designed to support relaxation and help calm racing thoughts when life gets intense. Check out Chillax at lifehappens.com or on Amazon. On field, assessing first, airway, breathing, circulation, making sure mentation is good. Walking, neurologically intact from what we can see, what they probably are assessing on the field. You want to push on the bleeding as much as possible to try to get the bleeding to stop. The scalp tissue is very thick.
Pretty thick.
At times when I'm looking at the scalp repairs, it's almost like a centimeter thick, probably not that much, but at times it is. It is very vascular, so it's going to bleed a ton. Oh, nice. They're stapling it back together. They're pinching the skin together. Why are they doing that?
Why did I do that?
Unlike a suture where you're taking the thread underneath and then you can actually pull it tight, you can't do that with a staple. The staple is just hooks and then it's going to pull tight. So if you're not close enough, it'll close it, but it won't squeeze it together close enough. Oh, really dangerous tackle. That ankle, it is like totally trashed. Hitting that right ankle, you increase the risk of snapping that medial malleolus, which is the distal end of the tibia on that side. When somebody comes to the hospital, we're going to get x-rays. Could be a fracture dislocation, could just be a trimalleolar fracture, an isolated fracture. Oh, hit to the head, out cold. So hitting the head, unconscious. Okay. Still breathing. Whoa, don't do that. Don't do that. Tongue is maybe out of the mouth. Is that why they are sticking hands in the mouth? You get an increased risk of losing your own fingers. If you're concerned about their airway, just lay them on their side. They will breathe through their nose. Reacting to sports injuries is good so you guys know what to do in scenarios in these type of events. But I do not wish anybody to get injured. If you do want to see more injuries that have already occurred, please let me know in the comments, and let me know too if you're excited about the World Cup. If you're going to watch that, definitely check out this playlist right here. Binge watch everything, and do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.